Well, welcome everybody to the Ignite stage and to this particular session where we're looking at the Thematic Platform on emergency and disaster risk management for health, and particularly focused on research and gathering the evidence for effectiveness when it comes to health emergency and disaster risk management. My name's Jonathan Abrahams. I work at the World Health Organization in Geneva, and co-speakers will be Virginia Murray from Public Health England and Sharon Low, who's working at the Chinese University of Hong Kong. Now, many of you would be well aware that health is central to emergency and disaster risk management, and for very good reasons. There are hundreds of thousands of people who are killed each year because of emergencies and disasters. There are millions of people whose health is affected by these emergencies and disasters, and that can take many different forms in terms of injury, illness, and some of the medium and long-term effects related to disability, to mental health, and to the exacerbation of non-communicable diseases. So, many of you will be aware that in the Sendai Framework for Disaster Risk Reduction, there are now something like 35 references to public health, really giving a fantastic instrument not only to the health sector, but to all of the actors who are contributing to health outcomes due to emergencies and disasters. And you're all involved in doing that. You are all involved. So, there are some other things that I encourage you to read in the Sendai Framework, but in order to implement the Sendai Framework, we have established a new research group. This research group is associated with the WHO Thematic Platform on emergency and disaster risk management, and that was established in 2009, the second year of the International Strategy for Disaster Reduction campaign on safe hospitals. And this thematic platform, to which you're all invited to participate, is focused on catalyzing action around emergency and disaster risk management. So we really want to see who's doing what when it comes to emergencies and disasters, and try to facilitate collaboration in this regard. Now, one area of that work is around research, and that's why we have established this research group, which is going to do a number of things which my colleagues will talk to you about. Thank you.
Thank you, Jonathan. So as he mentioned, health emergency and disaster risk management is an incredibly important field because it brings together diverse fields such as health system strengthening, disaster emergency medicine, humanitarian medicine, community resilience, and more together under one umbrella framework. So one of the things that our WHO Thematic Platform for Health Emergency and Disaster Risk Management Research Group aims to do is to unite these diverse stakeholders to address a very fragmented field. So this group was established in 2016, September, and as Jonathan mentioned, it's part of the wider WHO thematic platform. And its aim really is to bring together different stakeholders to build the evidence base and to do joint collaborative research projects, identify the gaps, to be able to coordinate activities, as well as provide technical advice to UN agencies in this field. Because as we all know, health is an integral part to DRR. When we look at all of the tragedies and the impact of disasters around the world, it's typically measured in impacts to life and livelihood. Some of the core activities that this group has undertaken over the past, how many months? 9 months so far, has been providing research support to different agencies, updating the WHO information sheets and fact sheets on health emergency disaster risk management, which Virginia will be going more into in a few minutes. We are hoping to maintain and develop a directory of all health-EDRM activities in an effort to try and reduce the amount of overlap and to increase the strategic direction of the research field, because right now a lot of the gaps are not being addressed, but yet many people are still doing research in similar fields. So, in addition, we will support the coordination of various health-EDRM thematic meetings. Out of all of the different meetings that have been happening over the past couple of years with the Thematic Platform, a lot of research gaps have been identified. So some of them including having all hazards and vulnerability approach. So typically, health research tends to focus mainly on infectious diseases and sometimes emergency response. But being able to address all hazards is really, really important. In addition to addressing all stages of disaster, not just response phase, but also looking at the preparedness, mitigation, rehabilitation, and reconstruction phases too. A lot of the health research so far has focused mainly on case reports with limited addressing of interventions. So there needs to be more comprehensive evaluations and also a standardization of how we are reporting the health outcomes of disasters, because we can't be comparing apples with pears. We need to be comparing apples with apples. Some of the challenges that face this field is overlap, which I've mentioned, and the lack of strategic research agendas. So we're really hoping this WHO Thematic Platform will address that. Limited development of multi-sectoral and interdisciplinary approaches. So bringing people from diverse fields, not just the health sector, but also political science, geography, and other scientific disciplines together, as well as challenges in bridging the science policy interfaces and having coordination mechanisms. So now I will pass to Professor Virginia Murray from Public Health England, who will share more about some of the in-depth outputs of this platform.
Sharon, a huge thanks. Sharon has stood in for my good friend Emily Chan, who is the co-chair. I think we should give Sharon a huge round of applause. She's a great lady. We tried to get Emily on Skype because she's stuck in a taxi on her way here. Well, we've all had interesting journeys, but we're here. What I thought would be really important to share is the incredible leadership by Jonathan Abrahams. Again, doesn't he deserve the most massive round of applause? He has been such a motivator, such a facilitator to try and engage how we should be delivering better research and trying to share this in a much more effective way. So Sharon has been speaking on behalf of CCOUC at the Chinese University of Hong Kong. I'm speaking on part of Public Health England. So Public Health England is passionate about trying to implement disaster risk reduction, disaster risk management, and climate change adaptation with better research. So we have agreed for the moment to partner with the Chinese university, and they've even made me an adjunct professor. Wow! In Hong Kong, all the way from London, what fun. But the most important thing is we are now calling for your help. This platform will only work if you all engage. So going round is a paper that I think we've been sharing, which we've just published, about what the platform means and the content within it. Have you all got a copy? Everyone got a copy? This gives you the principles of what we're trying to do. Ah, we need a copy over there, sir. Hooray, please. Anybody, sorry, can I give it to this man? Sorry, forgive me. Lorcan will share another one with you. And Lorcan, wave, Lorcan. So Lorcan is there. Anybody who wants to engage, and this is called engagement, we'd love you to sign up. Why does it matter? You've only got to remember that Alistair, who's sitting there, wave Alistair, he's been helping us. He was mostly importantly dealing with the Christchurch earthquake. And the learning from that earthquake needs to be shared with all of us. But only a couple of weeks ago in Canada, they had floods that were really frightening, and they've asked for help. So working with the Canadians, we've shared all the UK flood information that we have and how we do our research on looking at the health impacts. But we've also talked to our wonderful colleagues in Brisbane, Australia. Hey, is this not sharing? We have to share and make it much easier to find the information in an emergency, but also to plan how we do this in advance so that we can get the ethical approval, the other systems that are required. Why does it matter? Because Jonathan, in his update of this great series of fact sheets, do you know we have one on ethics? Would you not like to see that? So we have an ethics one. So you can see that we're trying to improve how we do things and making sure that we're doing them properly all together. So this is the way that we want to try and engage you all in trying to take forward how we do this work. So if anybody wants to have a look at this, we don't have many copies. They will eventually go live on the website. So why is the Chinese University of Hong Kong such an incredible partner? Have you seen something they've done in China? This is the grab bag. This is the emergency resilience kit that they provide to all the communities that they work with on trying to facilitate what they need to do. And one of the things they include in there are medicines, so people know what medication they're on. And do you know one of the lovely things in here? They include a photograph of all their family. Do you know that's what we need to do, is to share this great practice? Don't you think it's lovely? I see a happy nod over there. So meet our wonderful friends from Hong Kong who are so inspiring. And we all need to work together. Have a look, sir. Enjoy it. But most importantly, engage. Join us in this incredible platform. And we can only do it through the wonderful help of Jonathan, who has been an incredible leader. Isn't that right, all of us? But also from the World Health Organization, we've got Public Health England, the Chinese University, but we've even got groups such as the Integrated Research on Disaster Risk engaging, and that's a really important group under the International Council of Science. And Tony, where are you? This man is the president of the World Association of Disaster and Emergency Medicine. What he does is amazing. He's going to be doing a special statement tomorrow, and we want to try and support him and other partners in trying to deal with this work. So it's this partnership, this networking we want you to engage with. If you have any questions, we're here to help. Thank you all. And isn't Sharon amazing? And aren't we sad that we've lost Emily in a taxi? Oh, she's arrived, Emily. She's here. Say something, darling.
So thank you for being here. I'm sorry. The security is very good. Okay, so thank you.
Oh,
Yes,
darling.
yes.
So, Emily, so we are co-chairs for the moment, and we'd love you to engage.
Yes.
So you've now met the team. Oh, and it's girls. Oh, no, we have Jonathan. We are allowed a boy.
So
Thank
for
you
those
all.
of you who are interested in engaging with this WHO Thematic Platform for Health-EDRM Research Group, there is some sign-up sheets to engage going round. So please make sure you put down your name, email, and organization, and we will be in touch shortly. And it's really important that we have stakeholders from all places, government, UN agencies, as well as academia, NGOs, because only together can we really strengthen this research field. Thanks.